Okay, so the pelvic girdle is what connects your lower limb to the axial skeleton. It also helps to transmit the body weight of the upper body into the legs. So it helps with support. And it also, your pelvis, your bony pelvis, also helps to protect the lower abdominal organs that you have. So when we talk about the pelvic girdles, the pelvic girdle, it is composed of 2 coxal bones. And each bone has 3 bones that make it up, and that as we develop, they grow independently of one another, and then they fuse when we become adults. So each of the coxal bones has a ilium. Each has an ischium. And each has a pubic bone. And then those together make up one coxal bone on one side, and then you have another coxal bone. Where do these coxal bones articulate with the axial skeleton? They articulate at the sacrum. So you'll remember the pectoral girdle articulates with the manubrium. The pelvic girdle articulates with the sacrum. So let's look at a diagram of this bony pelvis. This is my sacrum. This is what I call my sacroiliac joint. So this is abbreviated as the SI joint. This is a super important joint. It has some mobility in it. It is actually a, believe it or not, it is a synovial joint. Almost all of the joints in our body do have synovial fluid in them. And this is the one that can sometimes become out of whack, and it can make your, like the low back sacral area really tender. So this is called the sacroiliac joint. And this is where the pelvic girdle connects to your axial skeleton. Okay, so we have this part of the coxal bone. This is one coxal bone here. This is the other coxal bone here. One part is called the ilium. So if I were to put my hands on my waist, that would be putting my hands on the iliac crest of my ilium. If I were to sense where my pubic bone is, that would be in the anterior portion, and there is a symphysis here. So where the 2 pubic bones come together makes a joint, and it is fibrocartilage, and there's a little bit of mobility there. It becomes very mobile when we become pregnant. And so that's another joint that can sometimes get out of position and cause the pelvis to have issues. We can also see here that we have this ischium right down here. The ischium is like where we sit. The rough spots on the ischium are called the ischial tuberosities. We've talked about those before. Tuberosities are where muscles attach and they make the bone kind of rough. And so sometimes in like yoga class, they might talk about the sits bones, and those are actually your ischial tuberosities. Okay, so let's look at the difference between the male and the female pelvis. So you might have watched some science shows or some detective shows, and they talk about the difference in males and female skeletons. This is a place where we generally can see a big difference. Before we do that, however, I just want to point out in this diagram, we have the ilium, and then we have the ischium, and then we have the pubic bone. So these are in color. There would be joints if you were a juvenile. There would be joints between those. So you can tell the age of the skeleton if it is still growing. Okay, so let's go to the difference between the males and the females. Okay. So when we look at the pubic arch, this is shown right here, and you'll notice that the pubic arch is wider, right? And it is broader. So I would say my pubic arch is broader and more rounded. So in the female, the pubic arch than in the males. So the males are, the angle is more acute. So the pubic arch angle is more acute. What are some other differences? The female pelvis tends to be tilted forward. And this is really important for childbirth. We'll talk about that in a second. But that helps to make the birth canal broader and wider. So we tend to have a broader pelvis and in the females than in the males. So the males tend to have a pelvis that is not tilted as far forward. So tilted as far forward would be like tilted forward, not tilted forward. Oh, I can't see both my hands. Tilted forward, not tilted forward, okay? So the pelvis tends to be narrow and deep. Now, you know, some women have narrow hips, and that might mean that they have a different pelvic structure, and sometimes that might make giving birth a little bit more difficult, but not impossible. Okay. So if we look at the other differences, in this one, you'll notice that the sacrum is shorter right here, and the coccyx projects downward. So this actually makes there more room for babies to be born as well. So the greater sciatic notch, where the sciatic nerve runs, is a little bit wider here. So if I look at the male pelvis has a longer sacrum and the curvature is greater, and the tailbone tucks more under than in the females. And so that might get in the way of a baby moving through the birth canal. So let's look at the structures from below. So in the female pelvis, we have the inlet and the outlet are wider. So we have more of a space. And these spines are shorter. And if we look at the male pelvis, it's much narrower. So you could write that down, that the female pelvis is wider in general, and the males have narrower pelvises, okay? And that their ischial spines tend to point more inward, which would also make this a narrower opening for the birth canal. So if we look at the important parts of the pelvis and childbirth and why they are different in males and females. When we talk about the pelvis, we have a part of the pelvis which is called the pelvic brim. And so you'll notice here that this is like the narrowest opening right here. So looking down, we have the pelvic brim. Above the pelvic brim is what is called the false pelvis. So you need to know the false pelvis is superior to the pelvic brim. So false pelvis superior to pelvic brim. The true pelvis is inferior to the pelvic brim. And the pelvic brim is what defines like the opening for which the baby is going to move through. So it defines the pelvic inlet. So the head of the baby as it is being born has to pass through, it has to get through that space. The outlet of the pelvis, like where it comes out of the birth canal, right, would be defined by the coccyx, tailbone. Some women, when they give birth, they actually break. It actually breaks their tail, and that can be extremely painful, if you can imagine. And then the ischial spines are also, they make the part of the outlet. So, and it's also bounded here by the sacrum. So the wider and broader that area can be, the easier it is for the baby's head to pass through. One of the problems with humans is that our infants, our fetuses have huge heads, and that is kind of a evolutionary weird thing but it actually, we would think that maybe the heads would get bigger, except for the fact that we have to give birth to them, right? So our heads are constrained, especially prior to having C-sections. The size of the pelvis constrained how big our heads could evolve to be, right? So it was a constraint on skulls. What things does the baby have to make it easier for them to move through? You'll remember that the baby skull bones are not fused. So the suture joints are mobile, and there's actually membranes called fontanelles. And so as the baby passes through, the head can actually be squeezed. And sometimes babies come out with really misshapen heads because of that, that being born and maybe being stuck in one position for too long, right? So that is another adaptation, is having that soft skull that is able to kind of conform to the shape of the female's pelvis.